Hospitals feeling the COVID crunch have turned to the National Guard for help. There are currently 500 Guard members deployed to 31 hospitals across Kentucky. 15 of them are now working their second week with St. Joseph Health Hospital in Lexington. Danielle Miskell is at the hospital now where she spoke with members of the National Guard earlier today. Danielle.
Yeah, Kentucky reached a milestone yesterday, 1 million confirmed cases of COVID-19. So that should paint a picture of the strain these hospitals are feeling, as well as the relief these nurses feel when they see men and women in uniform walk through these hospital doors. A little help goes a long way.
I know the last 2 years have been stressful. The fact we get to come in and physically help them make their jobs easier, let them spend more time with the patients, is rewarding.
Nurses are now turning to the Army National Guard once again to take on some of their many responsibilities.
It's one of the things that stands out is that the nursing teams keep asking for the same guardsmen to come back. They develop a relationship with them and they want to maintain that.
Returning 4 months after their last deployment in September, this time the National Guard are allowed to be inside the hospital, even in patients' rooms.
They're seen as heroes, actually. Really appreciate the way that they've kind of just jumped in and become part of the team.
Logging charts, sanitizing the hospital, transporting patients, even helping nurses, like in last week's snowstorm.
We have gone through training with the nurses, and they have really stepped up and helped us out because that in turn helps them out.
They're also subbing for members of the technician team out sick with COVID-19.
It may not be somebody that can provide the same level of care as a nurse, but they have somebody that's a helping hand to them to get through this.
Some soldiers just arrived from Western Kentucky helping with tornado relief, but this is a different type of mission.
Like, these people are having a hard time not being able to see their family as much in these conditions. Try to put yourself in their shoes.
The command group arriving today to check up on this team.
How's it going? Are you enjoying the mission? How are you being treated?
After visiting several hospitals, they say the nurses only have one request: to send more help. These Guard members are here 7 days a week from 10 a.m. in the morning to 10 p.m. at night. Now, Governor Beshear's memorandum states that they have to be deployed for 30 days, which is going to be coming up on April 1st, but that date could be extended. Live in Lexington, Danielle Miskell, Fox 56 News.